Lindsay Parkhill is a radiology technologist at Millard Fillmore Suburban Hospital and joins us on Medically Speaking today. Let's start by talking a little bit about yourself, how long you've been at Suburban, and what you do.
I'm a radiologic technologist at Suburban. I've been here for 16 years next month. I do x-rays. I also work in CAT scan and interventional radiology also.
You've been there for 16 years. You guys have seen an awful lot, the growth of the hospital, the expansions. You've seen other public health issues, H1N1, massive flu situations. But this pandemic that we're in is a little bit different, probably actually much different for you guys in the sense of the severity of it and how much it's impacting. What's it like dealing with COVID-19 in your role?
It's scary. When it first started here and we got our first patients, we're very careful with our, PPE. They've been doing a fantastic job with putting out on the patients, like who have the symptoms of it so that we are properly dressed to go into the rooms. The ER is tricky because, they're walking right in and you just treat everybody as if they have it just to be safe.
So in saying that, what's the difference in terms of your daily routine? Is it, the amount of PPE that you have to wear? Is it just the anxiety just going into work, knowing that you're dealing or potentially dealing with, positive patients?
Yeah, it takes definitely a lot longer to do the case, just to get all fully dressed, to go in, to do the exam, and then to, when you take the equipment out from behind the patient, to properly clean it so it's safe for the next patient. It's just a longer process.
A lot of others that we've interviewed on this show talk about, well, this is healthcare. I work in a hospital. This is what we signed up to do. As you went through school and as you began your career, could you ever imagine a public health crisis or a pandemic like this and literally being in the middle of this?
No, I never imagined this. It's still, we got trained like what you said, H1N1 was coming through and Ebola, we got properly trained how to, put on our stuff and take it off correctly. But we never, that never turned into something like this, day to day, and it's for as long as it's been going on.
One thing that people may not realize, but, we've talked about a few times on the show is Millard Fillmore Suburban Hospital may not be seen as, a facility that is the big academic health center and all that, but it's grown into a very large, sophisticated hospital. And this COVID-19 crisis is probably a pretty good example. You guys are one of the largest facilities dealing with the COVID-19 patients. Mm-hmm. What's the team feel about that, or what's your views on that?
I mean, everybody's working together very well. The system is working well. We're going to patients' rooms instead of having them brought down to us to keep the hospital, the other patients safe, just doing the best we can.
You're trying to do your best you can. The team is doing all they can to work together. But one thing you guys do share in common, I'm sure, is the added level of stress, both when you're on the job and then maybe when you're off work. So how do you personally cope with that while you're working and then maybe while you're not working?
At work, I feel it feels pretty good to be here. I feel like we are safe in this environment. We're doing, best we can, hand washing, keeping everything clean, all the equipment, constantly wiping it down, changing clothes before you leave the hospital, just to not bring it home to our families.
Tell me a little bit about your family and, how they are handling you going through this.
Well, currently, I have a daughter, she's 6, and we're building a house. So we're living with our in-laws right now. So that was tricky to bring it home. I didn't want to get my in-laws sick. And then she takes care of the grandma. So we didn't want to, have them bring it to her at all. So it's been difficult, but doing, just trying to keep us clean. Everything clean, leave it at work,
Sure. So let me ask you a little bit about when you're leaving for work, when you come home from work, what's your daughter ask you about, or, what do you tell her when she says, how was your day, or, what happened at work today?
It's good. She asks me, she's like, when is this silly coronavirus going to be over? And, because she misses her friends, misses school. I just tell her, that we're treating the patients, getting them help, better, and trying to end this.
In terms of the community support, Millard Suburban has really been embraced by, whether it's the local businesses or the surrounding neighborhoods. What's it feel like being part of that outreach?
It's been amazing, the community, all the food that has been brought in, the chalk that's on the sidewalk when you walk in the door. I mean, it puts a smile on your face every day when you walk in. The parade of the first responders was amazing. And then the flyover last week, it like took your breath away.
So in saying that, the stress that you guys are under, how difficult the working conditions are with all that extra PPE, when you see that type of community support, does it make it a little easier to deal with, or do you feel a little bit better about, okay, people do understand how challenging this is, and, it makes it a little bit easier on you?
Yeah, definitely does. And then, the patients, they thank you, which I just, like I said, I'm just doing my job, but it makes me feel great when they, you feel very appreciated.
So we talked about the community. Let me just ask you about your coworkers. You've seen some incredible work and dedication over the past 2.5, almost 3 months now.
Yeah.
What's it like to be part of that Millard Suburban team, and seeing some of the work that's gone on in dealing with the coronavirus?
Definitely, it's great. The teamwork here is wonderful. Everybody, pitches in. Everyone does takes their role. Even the environmental, it's just they're very stepped it up, made it very clean in here.
So as we wrap up, let me ask you, are there any messages of thank you, whether it's to friends, family, coworkers, community, that you would like to express from your standpoint?
I would like to say thank you to the community for outside. They put up signs, the notes on the ground with the chalk. It really makes it feel less stressful coming in.
Great. Thanks for joining us today. We appreciate all that you guys have done and taking care of our community and taking care of the patients who do come through the doors at Suburban. So thanks for joining us.